Happy Wednesday. Okay, we are talking about gut health and how that relates to anxiety and depression this week. I am Dr. Jordan Leasure with North Shore Proactive Health. I am a functional medicine based chiropractor out of Chicago. And I don't know if any of you noticed, but our original video is back online. So if you have not seen it, please go back and watch our video on depression and suicide. It was very personal, it was very important, and it sets the groundwork on why we are talking about this topic going forward. Hello, Dr. Jade. I think you should be seeing patients, not watching me. I'm going to take Dr. Jade's advice and not only introduce myself, the topic, and give a little bit of a disclaimer this week. Please remember that anything that I discuss is not meant to be medical advice. It is not meant to be a diagnosis. It is meant to be suggestions and education only. If you have further questions, please feel free to contact myself at Dr. Jordan Leasure or our office at North Shore Proactive Health. The supplements that we mention, that we promote, and that we sell in-house as well as in states in the union are North Shore Proactive Health's original line by Dr. Jade and myself is Salutogenic Life. So anything that I mentioned, those are the products. They can be found on our website. They can also be found at salutogeniclife.com. So please take a look at that if you have questions or concerns on the supplements that I mentioned going forward. A couple notes that I made, if you see me looking off camera, I wanted to make sure that I hit some really important topics tonight. Hello, Jan. And with this being such an important topic, please remember that by no means do I think I'm going to be able to cover everything having to do with gut health and the brain in the 10 to 15 minutes that we have tonight. So this is sort of to, hey, Fumi, set the stage, lay some groundwork, and get you interested and let you know that if you are currently suffering from anything having to do with a brain diagnosis, as most traditional physicians would say, if you have anxiety, if you have depression, if you have a child with ADHD. Hey, Shauna, I'm glad you're off of your programs and on to more educational topics. If you're experiencing any of that, if you have a kid with ADHD, if you know someone with ADHD, anything in the autism spectrum, any neurodegenerative diseases, Parkinson's, for instance, all of them have a gut component. So it's very important to take care of your gut health if you're not currently, and that can also be the root cause of some of these problems. So let's jump right in. And again, if there's questions after, please feel free to contact me. So a couple notes that I made. I wanted to talk tonight about what is leaky gut. It's a term that a lot of people hear. Some people have been diagnosed with it. I don't think a lot of people really know actually what it is. It's important to remember that your gut is meant to be leaky to a point. It is meant to allow nutrients to be absorbed into the bloodstream so that your body can process them, use them for energy, and pretty much everything that the body does requires a certain amount of energy, and we get that from our food. So if you picture your gut having small holes in it, and again, this is sort of a exaggeration on what happens in real life, but I think that it will help you understand what's happening. So we have some perforations in our gut. When our gut becomes quote unquote leaky, and that can be due to inflammation or any other disease process, those holes essentially open up and they allow for larger particles to be transferred in and out. So that can be a virus, that can be a bacteria, that can be a yeast. It can also be larger pieces of food, if you want to think of things on a macro level, and that causes inflammation in our system. So that's essentially what leaky gut is in a very, very simplified, quick and dirty understanding. So if you hear the term, now you kind of know it's our gut not working as well as it can and allowing for larger sized particles to be transferred in and out. Now, why does that cause a problem? So we want to make sure that we're keeping inflammation in the body to a minimum And if we have too much inflammation, we're going to have disease processes going on. And that can mean that our serotonin, our dopamine, our norepinephrine, our epinephrine, so if you think of those as our happy chemicals, are going to be out of alignment. So we're not going to have as many as we should. We're not going to have them where we should. And that is a problem. And that is what results in anxiety and depression. So if you are taking an SSRI, for example, which is one of the most widely prescribed drugs here in the United States, it stands for a selective serotonin reuptake inhibitor. So what that means is that if you have X amount of serotonin in your body, this medication shuts off where your body would absorb it, so more serotonin gets to fluctuate through your system. Now, if you only have this much serotonin, but you need this much serotonin to feel good, that's not going to make a difference. So what we want to do is to try to heal the gut so that your body can make as much serotonin as you need and that it gets utilized as it should instead of just recirculating over and over again. So I'm not trying to insinuate that you should stop taking your medication, but it might be something you want to ask your doctor about. Is my gut healthy? Can I be doing things to improve the health of my gut? And would that make me feel better? So I always suggest that my patients ask why. So when you go to your doctor, you should be like a 5-year-old or maybe 3, I don't know, and always say why. So if they give you a diagnosis, your response should be why. And when they give you the answer to that, your response should be why, so that you can get to the root cause of what's going on and how best to address that. That's what you want to pay attention to, and that's how you should be treated in your doctor's office. You do not have depression or anxiety because you inherently have a, how do I put this, a lack of SSRI. You're not deficient in SSRI medication. You have anxiety, depression, ADHD because of other compounding issues. And that's what functional medicine doctors would utilize to approach this condition. We would look at antecedents, which are the soil that these problems were initially grown in. We would look at mediators, which are continuing factors, compounding factors. So that may be stress in your life. It may be toxins that you're exposed to. It may be what you're eating. Too much of something, let's say too much sugar. It may be what you're not eating, enough vegetables, enough fiber. All of that will impact your gut health. We also look at triggering factors, and that could be a serious stressor. It could be the loss of a parent, loss of a child. It could be loss of a job. It could also be a toxin exposure. So if you worked in a laundromat in college and you're exposed to toxins, I have a good number of girlfriends that are hairdressers and they're exposed to a considerable number of toxins all the time. So detoxification is very key in gut health. So I would suggest finding a functional medicine practitioner. I'm trained through IFM. I always point people to the IFM website. It's ifm.org. They have a physician finder. So if you're looking for a certain type of doctor, if you're looking for a doctor in a certain zip code, they have great locators so you can find somebody appropriate to work with your case one-on-one. And that's always what I recommend. If you don't have a functional medicine practitioner, that you get one, because they are essentially like the coach and they can oversee the game plan that you're going to implement with your lifestyle changes. A couple other things I wanted to hit on real quick were, please don't forget that serotonin, dopamine, epinephrine, norepinephrine, what we think of as our happy chemicals, are not just having to do with mood. They're also having to do with gut motility, so how fast things are moving through our system, absorption, so how much nutrients you're absorbing. It controls blood flow, and environment, so the microbiome. What is going on in who's living in your gut? Are there good things living there? Do we have good bacteria? There's sort of a unawareness, I think, in the community of health that you can have. People think that microbiome is like a one thing. Do we have bacteria? Are we taking our probiotics? And actually the picture is much bigger than that. So you can actually have good bacteria that's out of whack. You can have too much good bacteria. You can have too little good bacteria. You can have too much bad bacteria, or there's actually some that we want in there. So maybe we don't have enough of, bad bacteria, what we would think of. You can have too much yeast in your system. You can have fungus in your system. And those norepinephrine, epinephrine, serotonin, and dopamine, those neurotransmitters that I mentioned, actually can control who's allowed to live there. So that's another reason that having a healthy gut-brain balance is very, very important. So please remember, if you are simply treating your anxiety and depression with a SSRI or a different pharmaceutical means, even if it's working for you, your gut is super, super important. So please make sure that it is being addressed. A couple notes that I wanted to mention. I looked into the Journal of Cellular Physiology. So if that's interesting to you, I do not subscribe, so I cannot share beyond this one point that I found. But remember that autism, Parkinson's, reflux, which a lot of our patients suffer from, unfortunately, we see a lot of that, along with anxiety, depression, celiac disease, diverticulitis, IBS, Crohn's, and ulcerative colitis. All of them arise from or have involvement with neurotransmitter dysfunction in your GI tract. So again, neurotransmitter dysfunction, we usually think of it as only happening up here, but remember our gut-brain connection. So our nervous system in our GI tract, our enteric nervous system, which literally runs from our mouth to the other end, the whole tube all the way, actually is nervous tissue that impacts how we're feeling. And not only how we're feeling emotionally, but how we're feeling in our gut. So don't forget that gut instinct is a real thing. So it will be stronger if your gut is healthy. So keep that in mind. I wanted to wrap up tonight. If there are not any questions, if you have questions and want to share, please feel free to speak up, because I could talk about this topic all night long. We're going to talk about next week what we call in the functional medicine world is a 5R protocol. And that's how we go about healing the gut if we don't have specific things that we are treating for. So I recently had a patient with a gut imbalance. Pretty much everything that could be out of whack was out of whack. So she had too much bad bacteria, she had a yeast overgrowth, and she also had a fungus. So we're going to kind of break her up and treat each of those things independently. She also, which was not surprising, had a little bit of a vitamin deficiency. So we're going to address each of those independently and make sure that she is feeling better. And really her only symptom that she noticed was a chronic cough. So a lot of people would think if you were going to your allopathic doctor and you have a chronic cough, you're looking at lungs, you're maybe looking at sinuses. And for her, I finally got her to do a gut test, which was awesome. And I was very excited about the results, even though everything that could be out of whack was out of whack, but it was a very good indicator. We now have a starting point. We know what we're going to treat. Hello, Lindsay. So it was awesome to see that she had all of these imbalances, because now she has an answer, and we're going to be able to address those. We're going to rebalance her bacteria. We're going to get rid of that fungus. We're going to get rid of that chronic yeast that's in her system. And we are hopefully going to then address the symptom of the chronic cough. So it's kind of an interesting case, and I'm very excited to be able to be helping her with that. So it's something that, again, you might not think of this when you're seeing someone. Shauna's question, do you do gut tests in the office? We do a lot of testing in the office. So typically what I'll do with a functional medicine patient is testing can be very expensive depending on someone's insurance. There may not be insurance involvement with some of the labs that we use. So what I like to do is sit down with someone. We do a very extensive case history. I call it from conception to current. And we literally look at everything from what was mom's health like when you were conceived? What was your birth like? Were you a vaginal birth? Were you a C C-section? Did you have vaccines? Were you breastfed or not? All of that sort of are those antecedents that lay the groundwork for what our gut health is going to look like forever. And some of those factors can work in our favor. For instance, if a baby was born vaginally and if the baby was breastfed, that lays a very good groundwork for their gut health, versus if they didn't have those opportunities, we know what we're kind of up against from the get-go. And then our life stressors will impact our gut health. You know, were you sick a lot as a kid? Did you have a lot of antibiotics? Or even as an adult, you have a heart condition and you have to have antibiotics every 6 months in order to have your teeth cleaned. So those are things we take into account as well. And then typically what I'll do is I'll make lifestyle recommendations. We'll work on it for a few months. And if we're not getting where we want to, then we'll recommend specialized testing. So on the flip side of that, if someone's already tried a lot, they've tried an elimination diet. This patient I have, for instance, has had a chronic cough for probably 2 years, and no one's been able to solve that problem. So for her, we jumped right in with some testing. So hey, Dana, there's options, and that's what makes functional medicine so much fun, is that it's so personalized to each patient. So some of the gut tests that we do are stool samples, which are not super fun to collect. They are collected in your house in the privacy by yourself, but even so, they're not the most fun thing. You can do gut tests that are, everyone's heard of a Sibo test, and that's actually an interesting one because it's air. You're blowing into little tubes. So that one's easy to collect, but the preparation is somewhat difficult because you're eating a specialized diet. There's things you need to stay away from, and the timing of the test can be complicated for some people. And then the one actually that I had the patient do that I was just mentioning was an organic acid test, which is super cool, and it's super easy. It's a saliva test as well. And what makes it so interesting is that essentially we're testing for metabolites, which is the easiest way to think about it is it's sort of the end products of some of these invaders. So I sort of call it like the poop of the poop. And you get to see what these things that are in your gut, what they're producing. And we get to see from those results, we sort of go and work in reverse, and we analyze the end products, and we say, okay, well, if this is present, then we've got a fungus. And if this over here is present, then we've got too much of a bad bacteria. And if this is present, or if this is not present, then we can extrapolate what our vitamin levels are like. So it's a pretty comprehensive test. It's pretty easy. It's interesting, and it allows us to see what's going on inside the gut without being too invasive. So yeah, we do testing. We do a lot of super awesome testing, and it's nice to see definitively what's going on in there because we can't know otherwise. So everything in functional medicine is more investigative, and instead of treating symptoms, we get to the root cause of what's going on and why someone is feeling the way that they are. So if you're interested in making lifestyle changes, which is huge because functional medicine is not about popping a pill. It is not about, some people say they practice functional medicine, but in reality they practice green medicine. So they're replacing medication with a supplement, and that is not functional medicine. I would rather somebody do that. So if you're feeling depressed, feeling anxious, and someone has recommended 5-HTP, or someone has which is very contraindicated if you're on an SSRI, so please make sure that you're not doing both at the same time. If someone's recommended improving your gut health by taking just probiotics, or if someone has recommended, if you're depressed, taking SAMe, they're awesome and they absolutely work, but they don't answer that why question, and that's what you need to be paying attention to. So that's what functional medicine does, and we get to the why, and we make lifestyle modifications. So the other thing with functional medicine is don't pay for the visit and don't make the investment unless you are ready to jump in and change your life and live congruently. And that may be making some challenging choices. So it may be giving up alcohol. It may be integrating activity into everyday life. It may be modifying your diet. And for some people that know me very well, Parker is gluten and dairy and sugar free. So not 1,000,000%. We went to Italy and he did taste gelato, but for the most part, we stay away from that because I know how important the gut is in his developing brain. And I don't want him to be suffering with ADHD. I don't want him to be suffering with anxiety or depression. I want to do everything I can as early as I can to make sure that he stays away from those things and that his brain is functioning as well as it can. And I know that the only way that I can do that is to make sure his gut is super, super healthy. So we are laying the groundwork of a very high functioning young man. So fingers crossed everything works out as well as I'm planning. But don't forget that it is never too late and you can incorporate those things as well. So if you found this interesting, please share. If you have questions or anything you want to ask privately, please feel free to reach out. And also tune in next week when we go over what the 5 R's are in gut healing. I hope that you have a wonderful Wednesday. Thank you for tuning in, and we will see you next week.